Hey everybody, make sure before you continue with this video that you downloaded and printed out the handout that goes with this section, and that you reviewed the introduction and at least read once over it so you have an overall idea what this intro is doing, and you can sort of read along as I'm going through different paragraphs of this introduction. So the study we're looking at today is a study published in Drug Safety. It's a fairly large clinical trial out of Taiwan. Here's the background objective. About concern has been expressed over the cardiovascular risk associated with rosiglitazone and pioglitazone. The study investigates the association between oral antihyperglycemics with myocardial infarction, congestive heart failure, angina pectoris, stroke, and transient ischemic attack. So it's something about the cardiovascular risk with these particular drugs. What is missing here, because you only get a piece of the abstract, is it has to do with diabetes patients, which the title kind of gives away. So that's the context for our study. So here are the first 3 paragraphs of this 5-paragraph introduction. And notice this introduction is called background. Again, it's the same thing as an introduction, because introduction provides the background, of course, as well. So there are a couple of really good things going on in this introduction. All 3 paragraphs really provide that kind of overview of what's known and provide this context for the study. So in the first paragraph, it starts off with the general description of what TZDs are, and what they reduce the body's resistance to insulin. However, so this is what oral agents that act as insulin, they improve glycemic control. However, meta-analysis recently have shown that they can actually, and other things, show some, raise some concerns about possible adverse cardiac effects of TZDs, right? So we're looking, the focus here is on patients with diabetes, and these TZDs have seemed to be very successful because they reduce their resistance to insulin, but they also create a whole host of other issues around cardiac effects, adverse cardiac effects of TZDs. And then so the first sentence tells us this is what we know about TZDs, this is what they do. However, there's some other evidence that really shows that they're complicated or risky in particular contexts. And then the last sentence here sort of is a very strong statement about why this concern is justified. This concern is well justified as cardiovascular disease is one of the most important causes of morbidity and mortality among patients with type 2 diabetes mellitus. So this is the focus of this particular study, patients with type 2 diabetes mellitus. So the researchers really the writers start off with the general description of TZDs, what is good and what is bad about them, but then really sort of finish strongly with a strong statement saying something about, hey, this is particularly an issue for this population, which of course we're investigating. Okay? So, and then the second paragraph provides more evidence in a chronological fashion about debates about the safety of TZDs, right? This is not a new issue. Again, this is what we know. In 2001, there was a study. Then in 2003, there were people published something about it in 2007. So this goes very chronological, showing that TZDs have raised some concerns among the scientific community, among the medical community, particularly around congestive heart failure. So this part is about the relationship of TZDs with congestive heart failure in a chronological order. Again, what do we know? We're still in the part of that first part of the triangle, the very general context. What do we already know about this? Okay? And in the last paragraph of this 3-paragraph part on what we already know, the context of the study, beautiful rhetorical move here, in addition to cardiac heart failure, recent studies explore other issues, right, that relate to TZDs. And there's a meta-analysis cited, some other studies. They all suggest that particularly these kinds of rosiglitazone and some other TZDs really have some adverse effects in this context. Then, debate was first centered on whatever this and this and this. So, you'll see some of these rhetorical moves these writers are making. They have really strong transitions. They have also really good structure in terms of chronological presentation of the data, in terms of how TZDs have affected one particular aspect they are focusing on, and then in the next paragraph, other areas related to cardiac issues. And then there's a really beautiful statement at the end of this paragraph that it really is sort of a lead into the knowledge gap. Here's some limitations that are being pointed out. And then here, on the other hand, to date, most studies examining the adverse cardiovascular outcomes associated with TZDs have been clinical trials. How their results apply to day-to-day clinical practice is not clear. So right here we have a knowledge gap or gap that needs to be further explored that the authors are pointing out. It's a great transition to this next paragraph that really should kind of tell the reader now, okay, so we now know, you told me what is known, the context, so tell me now what we don't know, what we need to worry about. So let's go to that. So paragraph 4, paragraph 5, let's focus on paragraph 4 first, which we have the research gap is clearly stated here in the middle. Again, starting with the however move, first saying this and this and this, and however, this is also known, or this is also kind of an important issue, contrary to what so far has been found and discussed. So here, however, questions on the effects of long-term use of TZDs in younger patients or in patients with diagnosed diabetes were left unanswered. Like most studies involving TZDs, the effects of dose and duration of cardiovascular events are left unanswered. In addition, a conclusive direct head-to-head comparison between rosiglitazone and prednisone has not been reported. So here the authors are already giving us some hints about what they will be investigating, right? What the study will be addressing, namely these research gaps that they've identified. And then here they have a really nice setup for the study's contribution at the end of this 4th paragraph. Together, these limitations indicate a great need for more information on the safety of TZDs and a need for comparison of the relative cardiovascular risk posed by the two TZDs. And of course, this is exactly what these researchers are doing. And so then in the next paragraph, they're basically answering the question they're raising here, or they're filling in, they're telling us they're going to fill in this research gap that they've identified in this particular paragraph. Right, there's a clear research aim here. They start off by using this particular database. They're doing this kind of study, blah, blah, blah. And at the end, we specifically designed and conducted the study to evaluate difference in cardiovascular events in use of rosiglitazone and pioglitazone. Exactly what they pointed out in the previous paragraph, what is missing, that comparison of the relative cardiovascular risk posed by these two TZDs, right? So here, there's a strong connection there. Research gap, guess what? Our research aim totally addresses that. So it's a really beautifully structured and well-written introduction. It's fairly complex in terms of the content. So if you read this the first time and you're like, woo, rosy glitter, what? That was exactly my reaction the first couple of times I read this. But even though you might not know what these specific terms mean if you're not part of this field, the structure is still very clear because the authors have done a really nice job in really foregoing their rhetorical moves and their structure and leading the reader along the narrative, so that you ultimately end up in this lower part of the triangle with a very specific research aim and a description of how that's going to be achieved. So in the next and last video for this module, we'll take a look at another introduction together as well.